Robin's a hard act to follow. For the record, the next speaker and I chose not to use PowerPoints before we saw the slide challenge. I've been a resident in rural Pennsylvania for almost all my entire life. I've been a nurse for over 40 years. I've been an advocate for rural, not meaning less in terms of access, quality, or outcomes for nearly as long. In addition, 40% of the Community Health Center, or FQHC, sites that I have the privilege to represent are located in rural areas. For many, when they hear Pennsylvania, they don't think rural. But according to the Center for Rural Pennsylvania, more than a quarter of the population live in areas that are classified as rural. 48 of the Commonwealth's 67 counties are classified as rural based on population density. And we're home to 59,300 farms that accommodate 7.7 million acres in Pennsylvania. I felt the need to share all of this as I sit in the middle of the only county in the state without an area classified as rural to speak to you about rural. We all know that the healthcare system is undergoing rapid changes that put population health, value-based care, and social determinants of health into our everyday lexicon. Rural regions and rural nurses are not immune to these changes. And if we aren't thoughtful and strategic in identifying ways to ensure that rural regions and their nurses don't get left behind in responding to the changes, the health equity gap for rural will widen. As Status Check 4, Rural Health in Pennsylvania asserts, the economic, cultural, social, geographic, and demographic characteristics of rural communities are sufficiently different from those of urban and suburban communities to require special consideration. I would assert that the same is true for rural nursing. Some things to consider. Issues unique to rural areas can have a significant impact on the health status of those living there. For example, travel time to all types of healthcare providers is generally longer in rural areas, and public transportation is either sporadic or non-existent. According to the U.S. Census Bureau, poverty is more prevalent in rural areas than in urban areas of the state. Just because rural poverty is more scenic doesn't make it any less difficult. There's a growing population of rural elderly, and with that comes increasing complexity of care. State agency data, such as that from the Department of Aging and Department of Transportation, reveal a higher incidence of elder abuse and neglect, a higher incidence of alcohol-related automobile deaths, poor dental access for low-income residents, and poor access to mental health services as important differences in the health status of rural and urban residents. The rural unemployment rate is higher than urban, meaning that there are more challenges in getting health insurance and being able to buy medications. And the opioid epidemic has disproportionately impacted rural. So what does all this mean for rural nursing and rural nurses? It means challenge as well as opportunity. For me, challenge is opportunity in disguise. The challenge of dealing with more complex patients translates into the opportunity for nurses to serve in new and enhanced roles. The challenge of environment impacting health, commonly referred to as social determinants of health, is the opportunity to enhance the patient education role of nurses and to grow in expertise to use data and population health strategies to more broadly impact a community's health status as well as that of individuals. The challenge of primary care provider shortages creates the opportunity for advanced practice nurses and other nurses to work to the top of their license and to develop new skill sets to take on new responsibilities. The challenge of workforce recruitment and retention creates the opportunity to practice in team-based environments like community health centers, to develop more holistic approaches to care that improve both job satisfaction as well as patient outcomes, with medical, dental, behavioral, and other healthcare providers working together in partnership with patients to optimize those outcomes. At the same time, saving money. George Washington University study found that having a community health center as a healthcare home saved significant total cost of care dollars. For our health centers in Pennsylvania, for example, serve 870,000 people. Those savings extrapolated from the study are over $1 billion a year. The challenge of new payment systems and incentives creates the opportunity to develop new and innovative approaches to improving health in partnership with payers. We didn't have those conversations in the past. The challenge of needing new skills creates the opportunity to develop creative education approaches for nurses to address them, perhaps similar to the Teaching Health Center and ECHO program models. And the challenge of some leadership void in rural areas really creates an opportunity for nurses to step into those voids and become those leaders rural areas need. I'd like to share a few examples of the significant impact nurses are making in rural Pennsylvania today, both current community health center examples. We have a thriving FQHC that was established in 1986 in a predominantly rural county by a nurse who saw the need for health care for migrant and seasonal farm workers. She actually started the health center in her basement. First year or two served 500 migrant and seasonal farm workers. Today, fast forward, that health center is serving over 50,000 people of all ages and walks of life in that county. Delivers nearly every baby in the county, is a HRSA Quality Awardee, is patient-centered medical home certified, and is a full-service, family-centered primary care facility that offers medical, dental, behavioral, substance use disorder, I can keep going on and on, services, all because of a nurse who saw need and became a leader in stepping up and responding to that need. The second, in an even more rural county, is a small rural health center that struggled under several different leaders until around 5 years ago, when the RN who built and coordinated their quality improvement program put her hat in the ring when, once again, there was a leadership vacancy. The health center is now thriving, recently added dental services, and often unmet need in rural areas to respond to community need and input from the care managers at the health center. Today, as of today, 6 of the leaders guiding Pennsylvania's 48 FQHC organizations are nurses, and I think rural nurses are uniquely poised for more to step into this leadership role. They're smart, they have people skills, they're calm in crisis, they're keystones of healthcare teams, they're teachers, they're committed to quality, and they're patient-focused and responsive. I hope education programs across the country respond to the rapid healthcare environment changes we're seeing in ways that rural nurses can also access. These nurses generally come with very strong foundational skills to succeed and with access to opportunities to gain new skills needed in this new environment like health informatics, data analysis, contract negotiation, population health, and enhanced care coordination. They're poised to become, as they are referred to in the RWJ Penn Research Brief, Nursing in a Transformed Healthcare System, New Roles, New Rules, the boundary spanners, or the interdisciplinary connectors who can help lead us into the future. In an article in yesterday's news describing a new University of Wisconsin School of Nursing initiative that places Doctorate of Nursing practice students in rural hospitals and clinics, the director shares that the experience turns out to be more challenging and satisfying than students expect. People may think the scope is small and that they won't see much high acuity stuff. Direct quote here. But people get hurt, sick, have a heart attack or stroke, and hit by cars everywhere. And then there are the farm accidents. As a result, the rural clinic staff students rotating through get to see and do things that would be outside the scope in the city, where you have medical students, residents, and specialists who are ready to take over. That can sum up, my words now, that can sum up the rural nursing experience. It can be more than you expect in every way. It's very important, and it's very rewarding. And with the right education, peer support, and other supports in place, nurses can lead us into the future in our next chapter in healthcare. Thank you.